I'm Ali Khader, PGY3 Radiology Resident at Leahy Hospital, and this is Radiology in a Minute. Bronchiectasis in low-dose CT screening for lung cancer. Radiology research summarized. The purpose of this study is to assess the frequency and severity of bronchiectasis and related clinical findings of participants in a low-dose CT screening program. Chronic smokers have an increased risk of bronchiectasis, which has been associated with increased all-cause respiratory and lung cancer mortality. Annual low-dose CT screening in the smoking population provides an opportunity to identify bronchiectasis early, prior to symptom onset, and follow its progression over years of repeated screenings. This is a single-center prospective study. The Early Lung and Cardiac Action Program bronchiectasis score, seen below, was developed to facilitate the bronchiectasis assessment. Current and former smokers aged 40 to 90 years were included in this study. Medical records were reviewed to identify associated respiratory symptoms and acute respiratory events during the 2 years after low-dose CT. 2,239 participants were prospectively enrolled, 48 excluded as per exclusion criteria. Of the remaining participants, 504 cases of bronchiectasis were identified, of which 300 had available medical records for review. The median LCAP bronchiectasis score was 12. Bronchiectasis was most common in the lower lobes for all participants, and lower lobe prevalence was greater with higher LCAP score. 2 years after baseline, low-dose CT, respiratory symptoms, acute respiratory events, and respiratory events that required hospitalization were more frequent with increasing severity of the LCAP bronchiectasis score. Prevalence of bronchiectasis in smokers undergoing low-dose CT screening was high, and respiratory symptoms and acute events were more frequent with increasing severity of the LCAP score. This is radiology research summarized. More results on this case can be found on radiology at rsna.org.